nurse practitioner Pat Bauer. My mission here is to help patients meet providers. And I feel so blessed to be with you today. I feel blessed to be with the patients that I hope we're reaching here today. And I feel blessed to be with you here today, Pat. One of the things that I feel really passionate about is the acronym of HOPE, is helping other patients, helping other people everywhere, helping them find providers. And right here in our very own St. Louis, right in the backyard, we have such wealth of information and providers that are providing amazing work. So I'd like to introduce everyone to Pat Bauer. Would you like to tell us a little bit about what you do and who you are?
Sure. I'm a nurse practitioner, and I made a specific decision when I went back to school to focus on how the body heals itself. And once I made that kind of change in my attitude, then I found treatments that help the body do what it's divinely meant to do, which is heal. And the first treatment that I found was IV vitamin C.
Nice.
And that's an amazing way to get the body back to health. And then I've done ozone, light. I've got some new laser therapies. I just love learning. I love bringing all this to my patients. I have the most wonderful patients because they are educated, they're open-minded, and they have autonomy. So they know their health is their responsibility. And I couldn't ask for a better scenario to help them heal. And it's just, I love going to work. It's fun.
Oh, I love that. I too, being a nurse practitioner, believe that we can heal ourselves. And I don't think that we're talking enough about that. What do you think, as far as we go into the Western medicine physician or nurse practitioner or provider, and are they getting the kind of education, or is what you're doing a little more intensive and a little more time is spent with the patients? How would you describe maybe a visit with a patient that would come in to see you?
I do spend time. I think that's what helps any healthcare provider connect with their patient, is when you can sit down, slow down enough to really listen to what the patient's saying, because their words may say one thing, but you do an exam or you hear something on the way out the door at the second visit, and you put the pieces of the puzzle together. So my initial visit is between 45 minutes and an hour. And it includes a lot of listening on my part, and then we do a brief exam and come up with a plan. Many times it includes some lab work if that's necessary. If it's not, we can just jump right into treatments or therapies. Sometimes the treatments and therapies are self-directed.
Right.
Someone comes in and says, I want to get some vitamin C. Well, I know how to give that in an acute setting. I know how to give it for a chronic issue, and I also know how to give it if somebody just wants to be healthy. So it's a conversation.
So tell us a little bit about the vitamin C. Like, who would be seeking to do vitamin C treatment? And I know you do other vitamins too. Vitamin B, and you do is it Meyer-Briggs?
With the vitamin C, we measure that by grams. So the first IV is 15 grams, and then we have to do a lab test that's checking for an enzyme, and the enzyme's abbreviated G6PD. That just lets us know that if we're giving you high doses of C, you're able to metabolize it. Then we can walk you up. You can do a 25 gram, 50, 75, or 100. If you're healthy and you want to stay that way, usually people get 25 or 50 grams. If you have an acute illness, let's say sinusitis or upper respiratory, a 50 gram is going to just knock out whatever's having a heyday in your lungs or your sinuses. And then the higher doses, 75 grams and 100 grams, those usually go for people who have, or go to people who have cancer.
Oh,
And it goes from being, any of the IV vitamin C that I give goes from being an antioxidant, if we were to take it orally, to being a pro-oxidant, meaning it's going to destroy the badly behaving cells or the unwanted cells. And people's immune system is helped that way. And then the immune system can take over and help create health.
do its job, basically.
Yeah, exactly.
So you're treating patients that have cancer. It sounds like you're treating patients more acutely, like sinusitis and things like that. And what other kind of things are you doing with your IV therapy?
Let me go back to vitamin C briefly. In the vitamin C bag is usually the B vitamins, so B5, which is called dexpanthenol, B6, which is pyridoxine, a B complex that has all the remaining Bs, and then some B12. And they're immediately absorbed, as is the vitamin C. They begin to do their work in whatever fashion, like the B vitamins are integral to nerve health and nerve conduction. And so the B vitamins always go in, then magnesium. And most of us are low on magnesium if we don't supplement. And so that helps balance between calcium and magnesium. Calcium makes things contract, magnesium makes them relax. And so when I can add magnesium into a vitamin C, people feel better. And then other IVs, I can ozonate your blood, and ozone is just a form of highly absorbable oxygen. So we are alive because we can breathe in oxygen, and that works to keep our cells functioning. And so we can ozonate your blood. It's done outside your body and then given right back to you. I can also expose your blood to ultraviolet light, and ultraviolet light is anti-pathogenic, so it kills bacteria, viruses, fungus, parasites. And when we do that to your blood, the killed pathogens go back into your body, and that upregulates your immune system. And so you know, when you first think about it, it's like, well, you're killing these, you don't want them back, but you actually do, because that teaches your immune system what to do with these invaders. And so it's really a gentle way to treat people. These treatments don't make you sick. They may make you a little tired, but usually by the second time you get them, you feel better. You begin, I hear my patients say things like, I feel like myself, or I have my old energy back. And that makes me happy.
Yeah. Can you give us a little example of maybe a patient that you treat there at the office with either the ozone or the IV vitamin C, and kind of like how they progressed through the treatments?
Sure. Let's see. Many times, let's pick ozone, and I'll briefly describe the procedure, and then I'll give you an example. We put in an IV. I take out approximately 240 cc's of the patient's blood, mix it with that amount of normal saline, and then that 240 cc's of ozone gas. The ozone is immediately absorbed by the white blood cells, and the other gases in that mixture, which are oxygen, is immediately absorbed by your red blood cells. So then give it right back to the patient. And an example, this is generalized, but people will come in and they'll feel extremely fatigued, and they don't know why. They're looking at the standard labs, and standard labs might say that the white blood cell count is on the low end of normal. Everything's on the low end of normal, but these people, they feel like they're dragging their their body around, and it's hard work. And so when I can ozonate their blood, it gets, it upregulates the immune system, and then the immune system is able to kill whatever's going on. Sometimes people will come in and they'll have elevated Epstein-Barr titers.
Mm-hmm.
And Epstein-Barr is a virus.
Right.
Most of us, 96 or 94% of us, get exposed to it before we're 12, before puberty. And it's a big bad cold. You want to lay down. If you're young, you want your mom.
Right.
And then if you're young, you get over it. You gain those antibodies to be able to fight any other presentation of Epstein-Barr. If you're past puberty, and you get exposed to Epstein-Barr for the first time, you get mono, and it's a much more serious infection. Well, there's a small percentage of the population that never gets exposed to Epstein-Barr as a child or as a young adult, and they get their initial infection as an adult.
Wow.
And that's even worse than mono. And so they'll get these, they'll have gone other places. They've tried other therapies. They land in a clinic like mine because their titers are really high, which means their immune system is just chugging along, but they can't keep up with the replication of the virus.
Right.
And so when we can get their blood ozonated and or run it by ultraviolet light, after 4 to 6 of these treatments, we can draw their blood again and see that the titers have come down, which means their body's taking over. The therapies have helped, but then their bodies are going to take over and keep that virus just in the background, not bothering the patient. So I see that all the time.
Huh.
And I get the patients who have been everywhere, just like you said, a lot of the other providers here in our area, we get people who've been other places, and it's our job to come up with a new therapy that helps them get over that hump.
I think it's interesting. Like at my practice, we would draw labs, and all the labs would be normal, and the patient would be like, "But I don't feel good." Well, the labs all look normal. What do you do with that? And I think that's where finding providers, I know like in functional medicine and integrated, you're really honing down what the lab values should be. So you're looking at lab values very differently than what Western medicine. So what you consider a white blood cell count being low would actually be normal at the doctor's office. So is that correct? You're looking at the labs very differently.
Right. I think people who look at health from a functional point of view, when they look at it and say, I want to get to the bottom of why this person feels bad, they see that some of these numbers that, standard labs, I mean, they have had reference ranges for 50, 80, maybe even 100 years, and they say they're normal. And a good example of that is thyroid.
Right. Oh, yes, absolutely.
TSH is not a very specific test.
And that's the standard of care, just so patients know.
Right.
When you go to the doctor and you're having your thyroid checked, that one number goes into a little box. And if you fit that box, then you have a normal thyroid, regardless of if you're tired or fatigued or having
your hair's falling out or
So go ahead and say something to that.
Sure. So TSH has this reference range between, let's say, 0.5 to 4.5. And like you said, people will be normal. They might have a TSH of 3 or 4 or 4.4. Doctor says you're fine,
right?
But they have all these other symptoms. And so when you find a provider who will dig deeper, and in my case, I'll look at free T3, free T4, and reverse T3. Then I'll also, if it's warranted, I'll look at the antibodies. And you begin to get a different picture of the patient. And so the hormone that I prescribe for low thyroid, which is what I see most of the time, is hypothyroid. Yeah. And people who are hypothyroid have an elevated TSH. And so hypothyroid people need some outside thyroid, and I use Armor or NP thyroid, and that allows our bodies to pick up and decide what we need. Are we short on T4? We can grab it, jettison the fourth molecule of iodine, and then we have T3. But once you start looking at the patient, and you treat the patient and not the number,
right?
We still use numbers, and we're in a sweet spot. People, practitioners like you and I and others, we're in a sweet spot now because we have medicine, we have modern medicine that's nothing short of a miracle. Absolutely. You know, if I had a heart attack or was in an accident, take me to the doctor and do whatever you can to save my life. And I'll be forever grateful. After that, it's my responsibility to keep myself well. And so here we are as people who look at the root cause, the bottom line. We can gather all the good work of Western medicine, and then we can integrate it with the function, what the old general practitioners did in the 40s and 50s.
Before there was any medications, and look at the patient's tongue, look at the patient's skin, look at, different kinds of findings, and we just don't really do that anymore.
Right. And going back to the thyroid example, the doctors would have the patient stick out their tongue. And if you can see the indentations of your teeth on your tongue, that means you have elevated mucopolysaccharides. Big word, fancy. Aren't you impressed?
I know.
And that tells me you're low on thyroid. And I always look at people's tongues that way. I'll check their reflexes. People have slowed reflexes or slow return reflexes. They're low thyroid. And so I'm able to do some good work because people years ago were very clever and very fearless, and they figured this stuff out. And now today I can use fantastic lab work to come together with a plan that helps people live their life. And I always tell people, my job is to make you well enough you don't need me, that you can go live your life. And if something happens, you call me up and you're my patient. And so you get in to see me quickly. But I want you to go live your life. And I don't want you to be tied to me. And I don't want you to be tied to, $500 worth of supplements. My job is to get your body working well, and they're gonna do it. It's not me. But I can help them, and people respond to that.
Yeah, I think it's interesting that you bring up thyroid. I feel like my Western medicine 18 years nurse practitioner, and then really have been doing more functional for the last 5 to 10. But I think it's interesting because like in Western medicine, we wait till that thyroid almost creeps up on a 10, the TSH that you were talking about. And really, by that time, patients are very symptomatic. And catching this earlier, and then the second thing that happens a lot is we go with Synthroid, which is very different than the Armor. So I just want patients to understand, like, if you're not doing good on the Synthroid, that there are other types of therapy that kind of address the T3, T4, which I'm sure nobody understands what those are, but that's why we have providers like Pat here to kind of help you as a patient figure out, like, if the thyroid isn't getting better on your medicine, then you need to start looking at some other things too, because like there's other kind of things involved, like the selenium and vitamin D and vitamin A and things like that. So just so patients know, I also know, like, I've actually spent time with Pat, and I would encourage every patient to reach out to her. The things that are going on in your office are different than anywhere I've ever been. I have watched you put injections in a patient's back with the ozone therapy, and patients keep coming back to get that because it feels so much better. Can you speak a little bit to the ozone joint, like getting that
Sure.
joint?
Sure. The injection you're talking about is called a prolozone injection, and that means procaine, and procaine is generic Novocaine, which is a numbing agent, and the last part is ozone. And ozone is this is really cool because everything's connected to everything. Ozone is made in nature when lightning goes across the sky. So it's going across our atmosphere. And the clean smell you smell after a thunderstorm is ozone.
Really?
So it's made in nature. Well, in the 1800s, some really forward-thinking doctors in Europe figured out how to make it, and scientists, they figured out how to make ozone by running an electrical current across oxygen. And so it turns O2
through the oxygen. Okay. I'm trying to get this visual in here.
Okay, so O2 goes across a current and it becomes O3. And so oxygen becomes ozone. Well, in its form as ozone, it only wants to stay that way for about 20 minutes. And then it goes back to being O2. Well, in that 20 minutes, depending on what you do with it, it becomes highly absorbable by different tissues. So when I fill a syringe with ozone, and let's say I'm doing knees, I have lots of people who come to me and they're at the end of their rope because they've been told they need knee replacements or a knee replacement. And they just, something in their gut tells them, don't. And so they come to me and I do the prolozone injections, which is on a knee. I go from they get 2 injections per knee. So one from the outside, one from the inside, and it's procaine. And I leave the needle in and then put on a syringe of ozone and push that in. Oh, wow. And your joint feels full, like I pumped it up with a bicycle tire pump. And I'm getting that ozone into that joint within the 20 minutes. In my practice, it's within usually a minute.
Yeah.
It's into the joint and then the body absorbs it. So I've seen x-rays where you have a small meniscus, the cartilage between the femur and the 2 lower bones in the leg. And after prolozone, it grows. Nice. And it's not magic. We're putting oxygen into a joint. Joints they aren't highly vascular, meaning if you cut your joint, you wouldn't see a lot of blood. Mm-hmm. You'd see cartilage and bone and ligaments. So the ozone goes in and your body begins to heal. I can also use that same injection on backs, low backs, and I've had the injections in my low back, and the first time I had them, it took me 4 injections, so 1 week apart for 4 weeks. I had no pain for almost 6 years. And then I did something stupid. I picked up a 40-pound bag of potting soil.
You felt so good.
Because I did. So I have this bag of potting soil. As soon as I did it, I was like, oh, that hurts. So I held off a week, and finally I went and had another injection, and I don't have low back pain anymore. Wow. So something I'd like to add is everything that I do in my clinic, I've done myself. And I think that's important for me because then I can tell patients what it feels like, how long it'll take. And they're so, the therapies that I use are so, they just mesh with the human body. Mm-hmm. They're not in opposition to it. And so when I say I've had a vitamin C and it makes you thirsty and makes you have to pee, then when the patient has that happen, they're not afraid. They
Right.
know I did it. I can explain it. I can tell them what a prolozone injection feels like. They're not painful. Many people come in and they're anxious because nobody
Why?
likes having a
Anxious?
needle.
It's a
Yeah,
needle.
they don't like that. And I'll say the anticipation is worse than the injection. Really, all you feel is that initial stick, and then everything else just feels like I pumped it up.
Yeah, I've
And
seen you do those in the office, and I think the patients like they're just sitting there talking, and you're just putting the injections in, and they're just
and,
talking, and they're
and they come back.
and then they come back, and I know.
I had the nicest compliment from an older lady. I bet she's 80. And she came in and you could just tell she was in pain. Her face was tight and drawn, and I felt so bad for her. And it was her low back, and her daughter brought her in. And she says, I don't know if you can help me, but they want to give me, they want me to do back surgery, and I just can't do it.
At 80 years
At 80,
old? Oh my
80. And I said, well, I'm going to try. And what you need to do for me is just pay attention to your pain. So I'm going to give you these. She was a little nervous, and it was a non-event. And she said, okay, I'm really going to pay attention. So the second week, she said, when she came back, because I make the patient get the first two 1 week apart.
Mm-hmm.
After that, I'm in conversation with them, trying to ascertain how much healing they had, how much pain they have, and what's the best course of action. And so for her, we just scheduled her a third one a week later. And Thursday, she came back for her fourth one, and her face is softened. She was walking better. She wasn't using a cane or anything, but she was more stable. She got up on my table, and she said something and I couldn't hear her. So I kind of came around, and she said, I want you to know I'm 90% better.
Oh.
And she said, could you please get the other 10%?
Yeah, now I want it all.
Yeah. And I said,
start off with this much, and she's like, I want it all.
She said, I'm not kidding. I'm 90% better. And she says, I don't need surgery. And she says, I can go out and go in my garden. I can pick things up. And she said, I just didn't know that I could feel this way again.
The quality, just think about the quality. At that age, when you're having aches and pains, you just don't want to get up and do anything. So then here she is out in the garden, like outside, which we all need to be. And
exactly
enjoying life a little bit. I mean, that's so beautiful.
Yeah. That is what I do this work
that's
for.
From the heart, honey. Like that's in the heart, isn't it?
Is when I see, when people say, I don't have any pain anymore, or I can, I get a lot of people with GI issues. I don't have eczema anymore, and I didn't think that was connected to my gut, but now I don't have it.
Yeah, and I'm sure people are going, "What? The gut, the skin?"
But, yeah, how's that connected?
You got to come to this provider to find out how the gut and the skin are related to each other. You also You also do some therapies in your office that have like ultraviolet light. Is that right?
Yes.
Like, I've seen you do some therapy on somebody's fingers for arthritis. And then I know you have that big machine that you can actually lay in that.
I have a machine called a Hocket. So I'll back up. The Hocket is an ozone cabinet, and you sit in it, your head's out, and you take in ozone through the skin. I have a mild hyperbaric chamber. So it's a 1.2 atmospheres. It's pressure.
Who knows these things? Like,
I know, and you absorb oxygen through your skin. It's used a lot for neurodegenerative issues. I've never used it for.
Is it like if you're having numbness and tingling in your legs?
I've used it for that what I was referring to was people who have, I'm going to say, mild cognitive deficits. We won't call it Alzheimer's or dementia, but the more oxygen you can get to your body, the better the body's going to work. And with hyperbaric, it's tremendously helpful for the brain, because the brain's that's the pinnacle of if the brain doesn't have oxygen, you're nothing's happening. Yeah. So when I can put a person in a chamber and give them oxygen under pressure, that's what hyperbaric means. We see good results. We can combine that with IV vitamin C. Mm-hmm. That works really well in cancer patients. Then the light machines that you were talking about, I have a Weber endo laser, which is a German laser that has diodes to specific frequencies. And the frequencies, if you looked at, I wish I had my little piece of paper, but there's energy in the universe, and there's
all around
us, and there's a very narrow band of energy that we can see, and that's called the visible spectrum. And so this endo laser, the Weber endo laser, has various diodes for the various colors in the visible spectrum, and infrared and ultraviolet. And the neat thing about the Weber endo laser is we can get the different frequencies of light to the tissues 3 ways. One is transdermally. So if someone's got arthritis or an acute swelling, we just put the laser, drawn a blank, on top of the swelling, and it takes swelling down.
So this has been around. So that's just going to go right on top of your skin.
On top, right. And red
shines this light into that joint.
Mm-hmm. And red and infrared will travel through the skin between 1 inch and 1.5 inches. And this has been around.
Whole finger.
Yep. It's been around for years. The chiropractors have used this for 50 years. They were way more open-minded than standard medicine. And they would have a specific frequency, and they'd use it for that type of work, take away pain and swelling. Yeah. The other way that I can use the laser is to get the light interstitially, meaning I can put it in a joint. So let's say I've got someone with a really bad knee. They have all sorts of laxities in their ligaments and tendons,
so that means
and
weak.
It's loose. It's loose, and their knees popping, and that's painful. And then it's swelling because your body's trying to stabilize everything. Yeah. So I can put, right after I do Procaine and Ozone, I use a special needle. I can hook up the light and irradiate. That all that means is cover with light, irradiate the joint with a red light, and it speed heals.
That sounds so amazing. Like that
is so cool.
So amazing.
Like, I tell people, in the next 5 years, we're going to be healing with light, water, magnetism, frequency. It's coming. If you can keep yourself well for the next 5 years, you're going to see this huge jump to aligning with the human body rather than fighting it.
I hope you're right, honey. I hope you're right, because I can tell you, I've been to a lot of the same conferences and have learned some of the things that you're doing, and it is amazing. But I, like, coming from the Western world again, you know, the providers and things that I worked with were just not open to those things, and patients don't understand it because nobody's doing it in the realm of medicine right now. And
Right.
getting patients this information, like that is just what I feel so passionate, like spending the day at your office, like all these people are so excited about being there and feeling better for the first time, and nobody even knows like this stuff is going
That
on.
it's out there. Well,
Yeah.
and that's why one of the things that I do, and I think it's important, and I think a lot of providers here in the St. Louis area, what we do and should do is share our knowledge.
Yeah.
So some of the things that I do, I mean, if there were other providers doing the very same thing, and there are,
Yeah.
there's plenty of sick people to go around, and all of us got into this because we want to help. So if somebody wants to know about, you know, how does this work or how does that work, I'm willing to share what I know, because there's going to be things that I don't know, and I'm going to have people to call on and rely on, and so it works both ways. I think St. Louis is so far ahead of the rest of the country. I mean, we get a bad rap for so much, but that's all.
This is
That's
our sweet
this.
spot.
Yep. And we get, you know, with all the various, I'm going to say, the ways that people heal, we're way far ahead. And I think a lot of it is because we don't have a lot of ego going on.
Yeah.
It's like our job's to help. And if I can help so and so help their patients, that just helps the world. And it's all going to work out.
Yeah.
I don't have to be greedy with my knowledge, because some of the things that I work on and help people with, I have to go. I mean, I get people that are complicated, and I know nothing about it, and so I have to sit at my computer and investigate and try to find out what can I do from my lane, what I know, to help these people. And it's a lot of work, but it's kind of like reading a Sherlock Holmes novel, and you get the pieces and you get the clues, and then you say, okay,
got your little spectacle out looking for those answers.
Yeah, let's try this. Let me tell you a story about a lady who came to me, and she had something called polymyositis. And she called the office and she asked Lisa, she said, do you take care of polymyositis? And Lisa covered up the phone, and I was like, well, poly means many, myo means muscle, and itis means inflammation. Sure, I'll try that. And okay, so she had got an appointment. This is about 4 years ago. And I go to the research and I'm like, holy moly, what did I say I do this for? I don't know how to do this. And then I just started digging and breaking it down, and saw that it's an autoimmune disease. It attacks the muscles, you know, blah, 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 blah. Well, she was at the end of her rope. She was faced with spending the rest of her life in a wheelchair. And she was looking to me to help her. And I was upfront. I said, I've never taken care of a polymyositis patient before, but I'm going to help you, and we're going to navigate this. Well, this woman is nothing short of amazing. I forgot to say that she was diabetic also. Well, she's worked very hard to get her diabetes under control, but she doesn't have, I mean, she's got a little blood remnant telling us she has polymyositis, but we did IV vitamin C. She changed her diet. We did some of the ozone with the light treatments. It's nothing short of amazing. And I didn't even know I could treat or help people, but it's all about keeping an open mind and being able to say, okay, the body needs to do this, but if it can't for whatever reason, my job is to help it.
Isn't that so fascinating? I mean, that is just like a miracle.
It is.
Yeah. And I like, so impressed that you would just start digging in to find a solution, because like it's so much easier to say, well, see a neurologist, or you know, and here you are digging deep into the research and finding something to give hope. I mean, that's
and I think, yep, I think that is our job as providers. Is we can't take on too much. I mean, there are things I can't do, and I know that.
Yeah.
And there are people that I refer, but there are things that I know, and I'll be upfront and honest with the patient, and then come up with a plan.
Mm-hmm.
And that patient has to be engaged.
Yeah, definitely. I would like to really kind of underline that, because a patient can't just come in and do treatments and expect to get better all the time. I think there is a certain part of us that we have to take responsibility for our wellness. And then I would speak to the fact that most of the people that come to see you have already been through the medical system. Like, I'm sure she saw a neurologist. I'm sure she saw her primary care. I'm sure
she did.
She went through all of the processes and got the standard of care, and yet she still suffered immensely. And then here you are doing something that's outside of the box, and she's actually gets better.
Right. And the neat thing is she did it. Her body did it. All I did was understand that she needed to calm down her immune system. She needed to put the fire out. Exactly. So it's, I think and I feel there's a part of me that feels bad for these new young doctors. They're so smart.
Yes.
And there's so much for them to learn, and they've got great memories, and they, because there's so much information, they move in a really fortified lane, let's call it. Mm-hmm. And they can do modern miracles.
Yes,
but then
absolutely.
they can't open their mind enough to see that, it's about a badly functioning or poorly functioning immune system. And so I think, and part of my job is, if somebody wants to come learn about this, you can come see my facility and what I do. My collaborating physician, he is an open-minded MD. He loves this. He shoots me articles. I write him back, and we banter, what do you think about this, or how should I do that? I'm very lucky that way.
Yeah.
And I see that if the next step is about the function, and if we take the tremendous mental capacity of people like us and the MDs, we're going to get people better quicker. And that's what it's all about. Nobody wants to be in a hospital helpless. I think most people would help themselves if we taught them.
If they knew how to do some of these things. Like, just talking to you, like, who's ever heard of vitamin C or the B's, or knowing that doing those kind of things actually heals the body? And I personally feel like going forward, the immune system is going to be very key in what the healing process is. These autoimmune diseases, cancer, all of those, I feel like is fairly driven by it's driven by the immune system. And the thing you're doing is correcting the problem that's wrong. And then you're doing this more preventively, so that you can just kind of walk away from disease.
Exactly. That's a good way to put it. And like all this virus that we're all worried about, people ask me if I'm worried. I'm like, it's all about your immune system. Here's a little pearl, and it's from my research, and there's lots of other people saying it. So get your vitamin D level between 50 and 80.
Love it.
Take a little bit of zinc every other day. You don't need a lot, but just a little. And if it's in a multi, good. And then vitamin C, 1,000 milligrams a day. And if you start to feel sick, you take 1,000 milligrams every hour. The absolute only side effect of too much vitamin C is a loose stool. If that happens, you just back down. Back to an acute illness, you feel bad, something's going on. Taking that vitamin C, 1,000 milligrams an hour, till your symptoms break. And they will. Some people's break at 2 hours, some people it takes 6. But it's all about the health of your immune system. And don't ever let somebody tell you need something outside to fix you, because God made us this way. We're like self-healing.
Yes.
And if we get run down, so you have to take some supplements. But you get an open mind and you're like, oh, it's my responsibility. I can do this.
Yeah. I think we should be talking more about, in the terms of COVID, I think we should really be talking about more about what to do not to get it, and stop worrying about getting it. I mean, if we are doing everything right, and I totally 100% agree with you, like there's not a patient that came into my practice that did not have a low vitamin D. Every single person has a low vitamin D until proven otherwise. And
that's right.
Yeah. And the fact that we don't talk about it enough, like we get it from the sun, we're not outside, it helps upregulate our immune system, and the vitamin C, like these are just great little tips that you're giving people, and I so appreciate it. Is there anything else in your practice that you want to share that you're doing? You have a sauna, so you do some red light.
Yep, we do the last way with the Weber endo laser is I can take I was going to
fun. You just got
show it to you.
Little things. Yeah, show us. Can you do it?
It's so much fun, and I wish for everyone that they find what makes them happy, because there are people that are this happy about building something.
Yeah.
Or, I mean, and that's what I wish for everybody, because if you're happy, then things come to you and your mind isn't locked up and feeling, lack. Things open up. I mean, the reason I was able to help the polymyositis lady is I didn't know what it was, and I just had an open mind, and things came to me. And all of a sudden, I was able to help her, and that's divine.
I was getting ready to say, do you think there's a little bit of spirit work going on?
A lot. And like even talking about all this virus stuff, and it's like, don't let anybody put fear in you, because fear changes your physiology. And I don't care what the fear is of.
Yep.
But when you're fearful, a whole biochemical cascade begins and throws you into into not being in balance, and then things start happening. And most people, if I talk with them and I'm an astute listener, they'll tell me the day it started or the event that started it. And it's like, as a provider, I know when people have something fearful come up, that there's oftentimes a physical manifestation. And I'm not trained in all this. I just see it. And so my job, and we talked about it a minute ago, is to give people hope. It's like, let me do the research, and you just do what you can do at home, and I'll tell you what that is. Yeah. And then you come here and you do some of the therapies that I have, and we'll move forward. And it's just fascinating. There's so many smart people out there. They've written, they talk like this. We're gonna jettison forward. Just don't be afraid. Do not be afraid. God is in charge. We just can't be afraid.
And we got to get out of the way.
That's right. That's right.
And
you want to see my laser before we go?
Yeah.
Okay.
This is so exciting.
Okay. Let me see. Okay.
Isn't this fun, everybody? This is so amazing.
Let me turn this around.
Okay.
Camera's going to go around. Okay. So that's an endo laser, and each one of those silver tubes like this is a different frequency. You can see here, this is a red frequency.
Is like a light color, is that right?
Exactly. So people have probably seen this in high school biology, but you can see on that top bar, it's all the energy in the world, and a very narrow band of it is visible. So you can, all those, the colors that are arranged like the rainbow, those are the light we can see. To the left, we see ultraviolet, or we see it's there, but we can't physically sense it. And to the right, infrared, we can't sense it. But all in the middle are frequencies that we see. Like if we use green, that's blue, this is green. If I use green and put it in someone's, I'm going to turn this around now. I put green light into the vein, it upregulates hemoglobin. So when somebody's anemic, we can raise their hemoglobin levels. The most common light to put in a patient's arm is ultraviolet or red. Mm-hmm. And it's just fun, and I encourage people.
You like put the IV in the arm, and then you put the light inside of that little catheter or the thing that's in the arm, and then the blood, every time it beats through, it gets exposed to the light. Is that kind of how it works? Right.
That's it. Do you want a demonstration?
Yeah.
It won't take a second. I wasn't set up, but it doesn't take long.
I think anything that we can do to get people the information that they need, and I think seeing is believing. Like seeing it is like so different.
Right. Okay. So let me set this here. Okay. So remember I told you we can get light into the body 3 different ways. One is transdermal. So this probe just sits on top of the skin. No, it's dull.
Okay. Did you see that? Like, oh my gosh, that's a big needle.
This one doesn't go in. Let me show you something here, because I'm going to turn it on, and it will. A picture is worth 1,000 words.
Yes, indeed.
Okay, red. Okay, and we'll start it.
Oh.
Okay. So you can see that red light. I can put that red light. Sorry, I'm not used to being on camera. I can put that red light. You can see it coming through my finger.
That is amazing.
And so it really can get into tissue about an inch and a half, inch and a quarter. And it upregulates, takes down swelling, upregulates the immune system to clean out any kind of, we'll call it swelling. So that's one way, that's topical. The other way that we can we talked about putting it in a joint, is I use this needle.
It's small.
And I slide a filament, a fiber optic filament. You can see it. It's like rigid fishing line into this needle, and then I take a different cable. We're still using red.
This is
and I'm going to put red light through that fiber optic cable, and you can see it coming out the end.
Lift it up a little bit more. There you go. Oh yeah, that is so amazing.
So this can go, it's a needle. It can go into a joint, and it can irradiate or flood that area with light. And then this next thing is the coolest.
I'm excited about it.
So this is an IV catheter. And when you come to my clinic and you're getting an IV, we put this in your arm, in a big vein in your arm. And then I take that very same fiber optic filament, and I can slide it right up that catheter. Can you see?
Unbelievable.
And then that light is in your vein, and in 20 minutes, the entirety of your blood supply is passes by this light and is changed by the light for the better. It upregulates it. So this is fascinating. I think I'm one of, there's not even 20 of these machines in America. Really? And I would hope someday there would be many. Mm-hmm. But I like it that my mind just says, hey, we just keep investigating. And if my heart says it's good and it's working, and I mean, the fella that invented this, he's a genius, and he has a whole group of, and these are mostly MDs, but he's got DOs, he's got veterinarians, he's got dentists,
but
and they're all
animals too.
Yeah, then they're using light to heal people, and that's why I say in the next 5 years we will be healing in ways that we can't even fathom now. I can't even fathom it, and I know this, and this is unusual.
Yeah,
but it's out there. And when I talk to people, one of the things I tell them is go outside, get your skin exposed to the light, do some physical activity, because that's how we were made. The more you sit, the more creaky and painful things are. Yep. Eat good food, eat good fat, share your food with people that you love. If you don't have anybody to love, go find somebody to talk to, because we're not meant to be socially isolated. We're not meant to be alone. Mm-hmm. And if we open it up and talk to people that maybe you wouldn't think you'd want to talk to, but sometimes a smile, sometimes just being open brings people to you, and you share things that need to be shared. Mm-hmm. And so we're magnificent creatures. We don't think we are. We tend to be afraid. We just don't know how powerful we are. And I think all the troubles we have in the world, if we all knew, all of us, that we have this capacity for goodness and to heal, the world would be a different place.
There is way, 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 way more good people. And we hear so much of that negative, and it's unfortunate. Because
it is, and that's intentional. Yeah. That's intentional, and it's not. I don't say that being this kind of person or that kind of person. It's intentional. Somebody wants us afraid. Somebody wants us to think lack, and it's not that the world's all, puppy dogs and. It's just not. It's the world. There's things that happen, good, bad. How you react to it is number one thing that you can control. And secondarily, if we're not afraid and our heart's open, we can do things. And it doesn't matter what we're doing. We can be an engineer. We can be a mom at home. I mean, I raised 4 kids, and I remember somebody telling me, whatever you expect of them is what they're going to give you. If you spend your time with them, if you expect them to be little brats and you tell people how terrible Johnny or Susie is, that's what you're going to get. Yep. So you better expect better. And who tells us that? And we've lost it because who knows why we lost it. But you usually have a family, and then you have a faith. Those are the groups that tell you, do this, it's the right thing, you get a better outcome. So you did that, come back. You can move into the lane that gives you the best outcome. Mm-hmm. And I think if if we just know that we're divinely created, that our job is to make the world a better place, and everyone has a spot in it, and no spot is better than another spot.
Yep.
So don't get jealous. That is not going to get you anywhere.
Mm-hmm.
Just do what you were put here to do, and be kind to people. I heard someone say, Pat, you just have to be kind to those divinely in your presence, and that's what we have to be. God put them there, so be kind to them. And there's bad out there, don't get me wrong. I'm not a Pollyanna. There's bad out there, but like you say, there's so many more good people, and good people need to talk. So by all means, talk good, build each other up. And that's how the world's going to change, is that we know we've been manipulated.
Yeah.
And it's time not to be manipulated.
Yeah. And I think that's kind of even where we're talking about what you do, is being open to something that's different, being open to experience a different kind of health and experience different kind of providers. And I feel like every single patient needs to start hearing this, needs to start seeing that there are different ways to cope with illness, disease, and wellness. And Absolutely. It is my hope that people will watch these videos and spread these videos, because who doesn't need what you offer? Like, who doesn't need these things for wellness? And
it's a good space. I mean, I commend what you're doing, because people need to hear, and you're a perfect voice to do that. And you're doing what you're passionate about, and it's so cool when you line up with people that are happy, and they're happy because wherever they're at is where they're at. And do I want a car that never breaks? Yeah. Yep. But my car breaks.
Darn.
So I got to fix it. So I do like linking up with people like you that talk about the good and know the good, and then our job is just go forward, and we'll be fine.
So how do patients find you?
The name of my clinic is called Wildwood Integrative Healthcare.
I'm on with the beautiful butterfly.
Yeah. Oh, no, I have butterflies in, but it's a dragonfly.
Dragonfly. Yeah.
And I'm on Manchester Road in Ellisville. Mm-hmm. My website is wildwoodintegrativehealthcare.com.
Say it one more time.
wildwoodintegrativehealthcare.com. Mm-hmm. And I'm redoing my website, so some of what I talked about is so new. It's not on there yet, but in the next couple of weeks, it's a good basic website.
Yeah.
If you have questions, general questions, my receptionist Lisa knows. She's a wealth of information. A new patient visit. Right now I'm scheduling out about 3 weeks, and a new patient visit is $200. Follow-up is $95. Nice. I post all my prices so that it's not a surprise. Yeah. And I code all my bills. I don't accept insurance because I'd have to have 2 or 3 other people working for me. But I do code everything. So if you come in with a upper respiratory infection, I put that on your bill, and then you can turn it into your insurance, because that's a contract between you and the insurance company. Mm-hmm. Oftentimes people get reimbursed. Sometimes it goes toward a deductible, and sometimes no. But most people, they just want to get better, and that's what they choose to spend their money on.
Right. Absolutely. Well, I want to tell you, this is amazing conversation. I think people will watch this and think, wow, I didn't know those things were going on in St. Louis. I didn't know that I could go somewhere for wellness even. like just to go there to feel better without even being sick, like doing vitamins IV.
See, yeah, they could do the light, anything that I offer, people can do, even if they're just curious.
Yeah.
It's okay, because it's non-invasive except for an IV or an injection, but it's so gentle, and you know, if you hurt this much, it fixed, or that much.
You get that IV right in, it's like that, and the knees and that, and like you're just on it. So boom, everybody should want to be there. So thank you. And
you're welcome.
Thanks for doing this with me. And to all the patients, all we're here is to help other people everywhere, to provide some hope, and to give you some answers to problems that you haven't had a solution for. So hopefully they find you. So thank you so much.
You're welcome. Thanks, Donna.